So recently, I had a case where it was a 12-week-old puppy who had almost drowned and almost died. The family went boating, and unfortunately, Willie had fallen into the water. He ended up almost drowning, and his dad had to do CPR to get him back. Thankfully, they rushed him straight into Animal Emergency and Referral Center in Minnesota, and we were able to stabilize him. When Willie first came in, he was really shocky. His heart rate was really elevated, his gums were really pale, and he had a lot of fluid coming out of his mouth from drowning. He was really hypothermic, which means his body temperature is really low. It was only 93 degrees, and normal body temperature for a dog should be 100 to 102.5. So he was really unstable, and he could have died if the owners didn't bring him in and if they didn't do CPR. So one of the reasons why we recommended hospitalizing Willie for 24 to 48 hours is because we can see a lot of complications from almost drowning and from dying. First of all, we did blood work on Willie, and it showed that his liver values were 10 times higher than normal. And that's probably because of the CPR and just from doing the chest compressions, smushing the liver, but it's also from the liver not getting enough oxygen. So we were worried about that. We were also worried that he was going to develop an abnormal type of lung disease where they get too much fluid in their lungs from almost drowning. So we also did chest x-rays to make sure that his lungs looked okay. We also did follow-up blood work to make sure he was healthy. And unfortunately, he went into temporary kidney failure within a couple of hours, and this was just from his near drowning experience. So I was really worried about him all night long, but that's the benefit of an emergency clinic or a specialty clinic. There's a doctor, multiple nurses there, 24 hours a day taking care of him. I was really excited when I came back the next morning and saw how well Willie had recovered. He was eating well, he was breathing comfortably, his oxygen level was normal. His parents came in, and I was really excited because I was able to literally hand Willie back to the dad who had saved his life with CPR. Now, Willie was also owned by a daughter and a son, and it was really scary and really traumatic for the daughter who found Willie in the water, lifeless and almost dead. So I was so excited to know that Willie had survived this near-death experience and was able to go home back to his parents.